Hello, everyone. It's a privilege to introduce the next guest of the day. It is Dr. Sritharan. He's a consultant surgical oncologist from our neighboring country, Sri Lanka, and he's an expert in managing peritoneal surface malignancies as well as advanced malignancies. Welcome, sir. Welcome to ISO MVR CanCon 2024.
Thank you for having me here. Thank you for the invitation.
So, India and Sri Lanka has a long tie, but if you take the historical, geographical background, and even the ethnic backgrounds, so how do you how can we collaborate further to provide meaningful outcomes
Yes,
in the medical field?
yeah. I think the practicality, it is close by to Sri Lanka. The traveling is easy, getting visa and those things are easy. And second thing is the population. It's similar kind of people in the same in this region. So the disease is also similar kind of.
Similar.
And as you know, in Sri Lanka or India, we have very high quality training program with a lot of hands-on skill, right? So that's where we can looking forward to spread the new technologies, new methodologies, and together we have to work because India is a big force, recently developing a lot of new technologies, and they are one of the biggest country who produce medical drugs and other instruments as well. So while getting the technological advances happening in Western world, uh, we have to together implement those things and also see the feasibility and do a research on the possibility of having that among our population.
So you mean to say there should be more exchange of uh, equal minds?
Yes, yes.
Okay, there should be an exchange training program
Exchange
and a
training
training program.
programs as well. And even when I was in UK, I noticed because the new trainees lack in open surgeries, right?
Okay.
In our regions, we are doing a lot of open surgeries, right? Even though the minimal invasive surgery is the future, actually currently that is the trend, but the surgeon should know if the complications come, have to open. So I think there's a way to collaborate with the Western world to give an opportunity for their trainees to come and have a hands-on
Right.
experience on open surgeries while we go there and see their development and technological advance. So that's how we have to work. That's my
Okay.
view.
What are the scope of services you provide for patients with peritoneal surface malignancies there in Sri Lanka?
Yeah, actually, it's a developing concept in Sri Lanka. We have a HIPEC center in Kurnagar, and there's another HIPEC center in an army hospital in Colombo. There is one HIPEC machine we can rent out throughout the country. So we have surgeons who went to the UK in Christie. They have trained for peritoneal sections and HIPEC. So slowly we are developing, and in Kurnagal they have done more than 60 cases. So there's a series of patients, especially ovarian malignancies and peritoneal carcinomatosis. So those are the bulk of the disease. Yeah, that is one way to push the boundaries forward. So we are working on that as well.
What is the time of inception of these treatment programs in Sri Lanka?
It started like 4 years back,
Okay.
right? So there are 5-6 surgeons are involving in that actively, and the Sri Lankan Surgical Oncologist, they have a good network, and it's a small country, right? So things are moving good. I think for our country, we need 3 to 4 HIPEC centers to accommodate the need of the people.
I think that would suffice for the
Yeah,
population of Sri
I think
Lanka.
so. Yeah. So because these things should be centralized to it should be limited to one place. That is good for the patients because they will be handled by the specialized surgeons in that, and yeah.
So yesterday we had talks on transplant and all small bowel transplant, multivisceral transplant. How do you see the future of transplant oncology in Sri Lanka?
Actually, it's a shock for me, to be fair. I mean, take everything out of tummy and put the new stuff, right? Uh, but still, a long way to go. Even their presenters also are accepting. So this is only a start. So they are exploring whether to do it in one stage or two stage, or doing first surgery and control the disease. Then, so a lot to be done to make it so practical for everything. But I think we have enough expertise, right? And also we have to develop the supporting system. It's not only the surgery. It is we need good anesthetic team, nutritionist, physiotherapy, and every one of the team should be aware of the magnitude of work we are doing, and what are the things we have to be careful. So that is the big learning for me from this conference. So I spoke to the consultants from different part of the world. So together we have to build those. Because that's the way forward, right? Somehow we have to win the cancer.
Yes.
There are two ways. One is to find it, or three ways to prevent that. If not, do it at early stage. If not, yeah, push the boundaries.
You
So
have the idea, you have the right team, we
yes,
can push forward.
yes, we have to, as onco surgeons, I think that is our duty because uh, we can't go and fight with general surgeons for doing the
Right.
early cancers. No, that is not fair. So we have to push the limit. That is our duty, part of the duty.
So, like the theme for the ISO MBR CanCon 2024, it is salvage, pushing the boundaries for cure. So, we have moved from maximal cytoreduction moving towards transplant, starting from small bowel transplant to multivisceral transplant. I think that will be for the future. CanCon. I thank Dr. Sritharan for his time, and I wish him a good success and all his future endeavors.
Thank you.
Thank you for
so
your time.
Thank you so